Hello, I'm Dr. Jim Hogg. I originally trained as a chiropractor, then went on to specialize in applied kinesiology, which is a system that allows me to treat a wide range of structural, metabolic, and emotional stress type problems. One of the things we treat a lot in our office is carpal tunnel syndrome. Now, if you have carpal tunnel syndrome, you may notice certain things like pain in your hand, especially in the thumb area, or you may have loss of grip strength. You may have numbness and tingling in the hand, and the pain that you have may go from the hand up to the forearm. You may notice this more commonly at night when you're in bed. Carpal tunnel is actually caused by narrowing of the carpal tunnel. There's an area right through here, the band of ligament called the flexor retinaculum, and between that ligament and the bones of the hand is what's called the carpal tunnel. And if that area gets narrowed, it causes entrapment of the median nerve that goes to these three fingers in the hand, especially the thumb, and causes what's called a carpal tunnel syndrome. Now, a number of things can cause that narrowing of the carpal tunnel. If these bones in the forearm get separated, they tighten up that ligament and narrow the carpal tunnel. Also, you can have bones in the hand, the carpal bones, may misalign and narrow the carpal tunnel, causing entrapment of the median nerve of the carpal tunnel. Now, in general, repetitive motion like typing doesn't necessarily cause carpal tunnel, but the tendons go through the carpal tunnel as well. And so if that area is narrowed and then the tendons of the hand are going back and forth with typing or any sort of repetitive motion, that can cause those tendons to swell and take up more space and bring out more of the carpal tunnel symptoms. Carpal tunnel problems are usually caused by injuries that put the bones out of place or cause narrowing the carpal tunnel. One thing that is common is hitting something with the heel of your hand, putting a lot of pressure on the heel of your hand, sort of like this, and that causes these bones to separate, these long bones in the forearm, and that tightens up that flexor retinaculum and narrows the carpal tunnel. Also, having bones go out of place in the hand can be a cause of that. Also, heavy twisting, like if you're getting a tough jar lid off, that can also cause those bones to separate and cause the carpal tunnel syndrome. So what you want to do is avoid those things. You want to try to avoid putting a lot of pressure on the heel of your hand. Doing push-ups, for instance, the knuckle push-ups are kind of not only being macho, but they also help to take the pressure off the carpal tunnel. If you keep the wrist straight, you're not going to cause the separation of those bones very much. So it's the pressure of the heel of the hand on a pipe wrench or whatever you're pushing on, especially catching yourself like this can be a cause of carpal tunnel syndrome. A lot of times people in car accidents will catch themselves on the dashboard like this, and they'll cause carpal tunnel problems. Now, one reason the satisfaction rate for carpal tunnel surgery is right around 50%, which I consider to be low, is that often the problem is not just in the carpal tunnel. You can have nerve interference at the carpal tunnel, but also you can have it in the elbow, the shoulder, and the spine. So any kind of thorough approach to treating carpal tunnel syndrome really needs to take all those things into consideration. You can have very similar, almost the same symptoms from nerve interference at these other areas. And you can have problems with the carpal tunnel, you can have problems with the elbow, you can have problems with the shoulder that contribute to this, problems with the spine that contribute, or it could be all of the above. So you can have many different areas that contribute to the carpal tunnel problem. If you only correct this, you may get some improvement, but you're not really going to solve the problem. So as I said earlier, to help prevent carpal tunnel syndrome, you want to avoid pushing on things like that. Also, the heavy twisting, one thing that is helpful is if you get a pair of rubber gloves with a good grip, that decreases the stress on your wrist when you're getting those jar lids off. Also, you can do some therapy at home for yourself with a laser. And this doesn't have to be an expensive laser. There's a very inexpensive, very good quality laser you can get for around $40. If you go to my website, drhogg.com, that's drhogg.com/laser, I've got a link there to the laser that I recommend to my healthcare students. And it's a very good laser that for $40 it'll do a good job for you. And you can just laser this whole area in here for about 5 minutes every day. The laser decreases inflammation and decreases swelling and may actually help to heal the area. If nothing else, it'll help the symptoms, and it may actually help the area heal. Now, of course, if you have the bones out of place, you need to see somebody who can take care of that for you. Because even with the lasering and being careful, if the bones are out of place, you're going to have an ongoing problem with carpal tunnel syndrome. So you need to see a qualified healthcare professional to take care of that for you. And you can go to my website, drhogg.com, drhogg.com. Go to the bottom of the first page, and there'll be a link that says Find an AK Doctor. And you can click on that and find an AK doctor in your area. Well, I hope this has been helpful for you. And if you have other questions about carpal tunnel syndrome or about what we do here in the office, feel free to contact me. My email address is drhogg@drhogg.com, or you can call the office at area code 563-386-9494. Great talking to you.